Colleagues and friends, warm greetings on behalf of my government and people of the Federation of St. Kitts and Nevis. As the CARICOM lead head for health, HIV and human resources, I am indeed honored to address the launch of the Public Diplomacy Engagement Program hosted by our esteemed caucus of ambassadors in Washington, D.C. The efforts to raise the profile of the region while enhancing cooperation with the United States of America and US-based partners is highly commendable. Fittingly, today, June 29th, is the International Day of the Tropics, designated by the United Nations to bring awareness to the many challenges confronting us. Foremost among them is climate change, that without focus, attention, and action threatens our very existence. Over the last year, our entire world has been tested by the COVID-19 pandemic, bringing unprecedented challenges for our people, decimating our tourism sector, ballooning unemployment levels, especially amongst women, young people, vulnerable groups, and considerably subverting our post-independence gains. From inception, I have argued that our region's challenges in addressing COVID-19 and other threats deserve high priority, namely, access to finance based on vulnerability, not only per capita income, being the most tourism dependent region globally, being highly susceptible to the ravages of climate change, and having high levels of NCDs, which also increases the risk of death from COVID-19. According to the World Bank, the progression of the pandemic and vaccination efforts will have a major impact on the recovery of Latin America and the Caribbean. I am pleased that vaccination is well on the way in our region, with St. Kitts and Nevis having inoculated over 67% of our population with a first dose of the AstraZeneca vaccine. Our region welcomes and appreciates the Biden administration's commitment of 6 million doses of the vaccine, in addition to its contributions to the COVAX facility. This is indicative of the commitment of the United States of America to us and highlights our importance to the United States of America as its third border. While the pandemic has exposed flaws and weaknesses in our global systems, it also presents us with the unique opportunity to rebuild our societies post-COVID-19, with redesigned social and economic policies to build a more resilient and sustainable future, a healthy and green architecture that recognizing the cross-cutting issues of human, animal, and ecosystems health, indeed, a One Health approach. Let us also qualify post-COVID-19. There have been some 10 pandemics and public health emergencies of international concern in the past century, mostly originating in human-animal contact. COVID-19 is but the latest. Secondly, the forces driving more deadly pandemics are increasing. Human-animal contact, especially through destruction of our forests, over 1 billion international travel arrivals per year, an aging, unfit population with many NCDs, and climate change, especially speeding the spread of vector-borne and parasitic diseases. For regional and global health security, therefore, an integrated and all-of-society approach is essential, grounded in universal health care coverage and buttressed by strong national and regional public health capacity. With our Caribbean region on the front line, the CARICOM One Health policy was ratified by CARICOM Ministers of Agriculture and Ministers of Health in 2012 and 2014, respectively. Between 2014 and 2017, the One Health, One Caribbean, One Love program was implemented with training of 29 intersectoral leaders from 12 countries. The government of St. Kitts and Nevis is proud to have been among the country partners. This concept gained momentum when the bipartisan One Health bills were introduced in the U.S. Senate and House in the 116th Congress. Likewise, the recent G7 summit emphasized the, and I quote, strengthening of the One Health approach across all levels of pandemic prevention and preparedness, end of quote. Today, we will hear from some of our regional and international institutions and partners about their work in One Health, reflecting the global cooperation required to defeat this pandemic, improve global health governance, better prepare for any future pandemics, and to achieve the 2030 Sustainable Development Goals. Colleagues and friends, COVID-19 has reinforced the need for our nations to deepen the collaborative approach to addressing global challenges. Let us continue to strengthen our partnerships, working together to build the safer and brighter future for the next generation. I extend my very best wishes for the success of the public diplomacy engagement. One Health, One Love, One Caribbean, One World. Together we are one, and together we are strong. I thank you. May God bless your proceedings.